Normally I say hello, but that's a trigger word for my dogs to start barking. So I start out with like, so instead, how's it going? I'm Dale, your librarian. Well, you know what? For family and consumer studies, I don't think I'm the librarian, but I'm a social sciences librarian. And in the summer, when everyone's taking vacation, you landed in the best place. So, how do we approach this? First of all, and some of are things that you probably already covered. So, just fast forward. That's the beauty of a YouTube video like this. And I've done a lot of these since the pandemic. So I'm glad that you spoke out and said you preferred this, because that's like reinforces like the evidence for programming that I'm participating in with graduate students. So I kind of, by the way, I de-identified everything. Nobody's name is going to be mentioned in this. So the context, we have human development, social policy, which I nickname FCS. Policy is a great keyword that I'm going to come back to later, which might help more than when I was noodling around in the psychology databases and things like that. But I highlighted things. And when we look at psychology, I come from social work, psychology, and they're often looking at like, well, who's the population? I imagine trauma-informed care is like adolescents, K through 12, K through 16. That might be something that helps you narrow down. So if you're looking at a specific population, I was doing a study, I can't remember what I was doing. I've done a million things this last spring semester. But one of them, we noticed that if it wasn't like a specific population, I think it was like African American or Native American, something like that. There was tons of research, but then when you go down to a very narrow population, there was almost nothing. That's called a null search result, and that's where you can, instead of getting frustrated, you can have the mindset of like, oh, this is great. This has not been studied a lot. So be confident, and I will be working back and forth with you on this too. And I can totally understand where you're coming from. So, population to be determined. That might help narrow it down. We're looking at trauma-informed care. And I was thinking, in this current century, how often is that used? So I was wondering if there's like synonyms or related terms. So the first place that I would stop is, have you ever heard of this, Google Ngrams? Oh, by the way, I'm going to we're doing like the reverse pyramid. We're starting out general, looking at keywords, then we'll go into the databases, then we'll go into a very specific literature review database where you can organize things by how many times they've been cited. And if I wave, it's because I've got gnats. So Google Ngram is kind of like a history of words, mostly 20th century, coming up to our current century. And so you can type in something, and this is all the books, 150 years worth of books. And so if you type in computer, for example, you can see that kind of took off in the 1940s. So you know if you're looking for something earlier. So for trauma-informed, it looks like, and I did this search before, my face is in the way. It looks like that took off at the turn of the century. So we're good. We've got a good 20 years. But you can see that this is something very specific. It's canon. There's a lot of meaning tied into it in the scholarship. So I think we're good there. But if you find other synonyms, you would write those down, like right next to this, trauma-informed, and I'll help you go around that. And then care and play are different contexts, and therapy versus education. We might have to noodle around in that and see what the interventions are called. So let's dig in. One of my favorite places to start with. As we're gathering keywords, what are other names for trauma-informed? And we can also look for very specific things. So normally I would go to advanced catalog search, but this one, since we know we're good, you can see everything that I've looked at before. Trauma-informed. Sometimes you put in the hyphen, sometimes you don't. I think a lot of databases will. There's a programming language that just cuts the hyphen and pretends it's a space. So you don't have to duplicate those unless you're in a database that does that. Trauma-informed. Let's do trauma-informed play. Quote marks make those keywords stick together. So when we're looking at 70 million things, it will make sure that all three of those keywords stick together. So you can see there's two. Let's not be put off by that because they might call it trauma-informed, and then in another sentence they might say play therapy. But let's look up trauma-informed care. So we're starting to get a feel for things. This is best done. Yeah, okay. I didn't expect there to be such a disparity. As we look at trauma-informed care, you can go into books and all different things like that. But I want to look at all the metadata that describes them. So I'm going to just go into catalog, which is articles, books, book chapters, dissertations, DVDs, things that the academic library collects. Mostly academic, but there's some pop stuff that shows up in there. We're casting around for keywords. This is my first strategy. And it's always super slow because it's talking to like hundreds of databases. What you can do from here, I'm going to move my head, is instead of going through the 3,000 results, you can go through how those 3,000 results are described. When you're doing a lit review, this really helps you to avoid the pitfalls of, well, somebody called it something slightly different. So out of all of those, and we could, since you're doing a lit review, we can narrow down to articles too. Applying filters. You can narrow it down by date. I want to see trauma-informed care and play. And here you can see your date range. I'm going to leave this open, but in other databases I'm going to narrow it down. But if you go down to subject, subjects are keywords or subjects written by the author, publisher, sometimes librarians, very less so in articles. But you can see what disciplines it's showing up in. So this might guide your databases. So social sciences, obviously, mental health, psychology, there's another, maybe there's pharmaceutical interventions. Here's where we get into some of those other disciplines you may or may not want to go into, because a lot of those are covered here. Nursing that has a great amount of funding and a great tradition for interventions, discovering trauma, diagnosing trauma, when to promote it to social work. Here's our population. Here's our gender. So this is kind of like a rough dumping out the puzzle pieces and seeing what colors show up the most. Does that make sense? As you go through these, if you see anything that looks really good, you can, oh, there's like an instrument, a questionnaire. You can click on full text available and you can download it and save it. So first place, that's where I would go. I guess that's the second place. I did Google Ngrams first. So into the databases is our second section. You can go into those specific databases that you think might work. I have a curated list that I think will work as a good boilerplate for you, but you can go in by subject. Can you? There you go. So if you wanted to, so for example, like play therapy, is that going to show up in art and art history? So there's a lot of play therapy and art therapy that maybe fall under the same umbrella. So you can ask yourself questions like this. Maybe write down a list of the places that you go and go, yeah, this was great for this was great for this was a dud. Ballet, dance therapy, is dance therapy play therapy? So here's the nuances. I don't know if this is like going beyond art or dance, but as you come up with ideas, you can come up with different keywords. It's not what you have to do, but it's a systematic way that makes you feel better and record what you're doing. So there's all these databases. So for example, if you went into, probably the top one is going to be psychology. The official librarian, we have many librarians for different liaison roles. They will have chosen their favorite one at the top. What databases should you go into? Well, I have a curated list for you under my social work guide that I would recommend at this initial point to see if this is what you're looking for. Social work uses a lot of psychology, but there's a lot of practical interventions, surveys, questionnaires, and things like that too. So under research guides, you can find my guide. You can look for the psychology guide, but it's not set up in the same way. Mine's more systematic, that reverse pyramid, upside down pyramid. And there's all of these different librarians you can talk to. So you could reach out to Greg Hatch and say, hey, is there like trauma-informed theater companies, which I think there is, like Inner City Kids, a bunch of really, really cool stuff that's tied into a diagnosis of trauma-informed. So if you go to social work, and if you go to PhD and master's help, you don't need to remember how to get there because you have this URL, Campus Guides libutah.edu/social_work/PhD. This is on the open web. You don't have to authenticate for this. So down the left-hand column, the first thing that we've already done, really roughly, is validating keywords and concepts. Test out those ideas and see if there's a precedence for a specific name, a particular author, et cetera, et cetera. So library catalog's good for that. The open web's kind of good for that, but you might get a mishmash of people trying to sell programs and things like that. This is public policy. This one's kind of rough public policy. I'll show you a better one later. These are newspapers in the United States. These are court cases in Nexus Uni. Again, I can help you with those as you go in. Second step is discipline-specific research. And these are the names of my top favorite databases that I recommend for you. So I'll show you a demo, but my favorites are the ones that are big. I prioritize them, graphic design style. Sociological abstracts is awesome because you have cities, counties, municipalities, states, countries, the World Health Organization, the United Nations, and they might be working with refugee populations, they might be working with war-torn populations, but that one's really great because they look at psychology, they look at public policy, and they look at evidence-based diagnoses and interventions. Social Science Premium Collection is no longer new. I have to edit that. That one's pretty good. Maybe we should go into that one first. But my favorites for what you're looking at. Sociological abstracts, great for looking at society. PsycInfo is fantastic for looking at how trauma-informed care is strictly defined. What is trauma will be defined. What the care is would be evidence-based, so that would be a really great place to go. This one, Education Full Text Generic, is fantastic for looking at that younger population. Populations in the United States, as of I think 1964, are protected. And so it's hard to do research unless you get through IRB and say you're not going to harm. And for when you're talking to like a 52-year-old librarian, IRB says, yeah, you can do whatever you want. But if it's somebody that's 18 and younger, those studies are hard to get. Education Full Text has a lot of those. So it's not just schools, but it's school counseling and things like that. And lastly, PAIS. That's public policy all the time. And again, that's all over the place, including Salt Lake City. Public policy will be listed here, events and news, but this is evidence-based scholarship. Whew, okay. I'm going to show you one database, and then the systematic way that I do it will be repeatable in the other ones too. You can take notes as you go, as you fiddle this out. And you can take lots of breaks. I have ADHD, so I need lots of breaks. So I'll do Social Science Premium Collection. I like that. Back to safety. No, I would like to go. There's something with our easy proxy's not unsafe. That's strong rhetoric. Don't be put off by you're searching 34 databases or anything like that. Go to Advanced Search so we can break out our keywords. Oh, Lord. And I'm going to let everything load. Let my Zotero choke on that. I would click peer reviewed because there's going to be too much. Don't bother with the full text if you're doing a lit review. The Marriott Library doesn't own everything. Got like 85, 90% of everything. So some things you might have to request through interlibrary loan. Okay, let's go back to the keywords. Trauma informed. That seems to be the best one. Trauma informed. And then let's do, just for fun, let's try play or art or dance. Let's see what happens. So we're in social sciences. So it has to have trauma informed, and it has to have play or art or dance, or whatever therapies that might fall under play. Unless you're looking at a very specific play therapy, then you might have to name that. So again, look at that. Trauma-informed art and play therapy. This one has a lot of dissertations in it, so one of the first things I would do is click on scholarly journals. So that should trim us down a bit. Oh, only by 100. Okay. Here's where you can start to narrow down or do groupings of populations. So this one's children, mothers in domestic violence shelters. It's a very specific population. There's PE teachers. There's capoeira, the Brazilian martial art. I don't know if you're a Bob's Burgers fan. There's a great capoeira episode. There's dance. What is this that keeps showing up? Oh, remind me later, please. All these databases have little research helpers, but I'm all over the place, so I never go into them. If you want to do a lit review that it has like a very longitudinal study, I think that would be, it might be really hard, and it might be a long slog. So you could break it up into chunks, but typically people do like the last 5 years. Like, what have you done for me lately? Play therapy. Interestingly enough, we've had traumatic events. We've had the pandemic, so that could be a keyword as well. Whoa, that only took off 1,000. Here's where you can go in to the subject after you've done your search. And the same thing that we did in the catalog, you can see, but more specifically, what are people talking about? This might help you. This is quantifiable information. If you're doing a systematic review, the numbers of keywords are written down and you can draw percentages and things like that. So yeah, there's COVID-19, children, so you can narrow it down. Health services providing the intervention. So is it the effectiveness of the intervention, or is it the group that's providing the intervention? Children and youth, here's a specific population, families, PTSD, pandemics. You can look at qualitative versus quantitative. Looks like coronavirus is a theme. Go figure. There's violence, healthcare, again with the nursing. There's this specific kind of crimes. There is a subset of K through 12, so teenagers, adolescents, or children, or specific age ranges, drug use, etc., etc. This might really help you narrow down to what you're looking for. Instead of narrowing down in this, though, I would narrow down by adding a keyword. Let's go back to advanced search. Are you going to let me go back to advanced search, or are you going to choke? Come on, database. I want to add another line for that population. There we go. Is it going to erase it? I bet it is. Rats. Trauma. Not Truman informed. Trauma informed. Play or art or dance. And let's add a population. Children. And here, there's a whole bunch of different names for population. Sometimes. Okay, this time when I go in and I have the population named, it will narrow it down even further. If I want to go even narrower, I can say I only want all these terms to show up in the abstract. So if you want a shortcut, reduce the number of things that you're looking for these keywords in. And if you want it even ultra rare, you would, there's only 35 in the abstract. This is encouraging because then we can go back and sift through these a little bit better. And here you can see it took my whole search and it put it into that handy thing. So let's go back. Well, let's not go back. You can go, you can go back and do title. But maybe, let's get rid of children for just a second. So now we're just looking at the same ones that we did before, but we're looking just in the abstract, which means the author thought it was the most important thing if it was named. Now there's 134. You might work with your advisor on the rules for a review like this, but narrowing it down to abstract from 2,000 to 134 is much more digestible. So there we have nurses, graduate students. This is great. Oh, preschool classrooms. If you hear scratching from the other room, my dog is bedding down. Okay, let's try a different one. PsycInfo is going to be more specific on the population. Sociological abstracts, I'm not sure that they would. You might have to tool around and add keywords or subtract keywords. But let's go into PAIS. This one is public policy. So these are going to be governments that are taking the info from sociologists, psychiatrists, psychologists, nurses, and social workers, and they're going to say, okay, how can we imply this in a policy? So instead of advanced search this time, trauma, I'm just going to do trauma informed, and let's see what we get. And a lot of these will be case studies where maybe like a city worked with inner city kids that suffered from violence on a daily basis. Let's see what we get. Different paradigm. There might be some psychology, but there might be a lot of things in there where people are like, what did Los Angeles do? Ooh, yeah. So here's a law journal talking about delinquency interventions, instruments for exploring, preparing training people. So you can see you have your work cut out. You might ask your advisor, like, do I narrow it down to the people that are being trained to do this? Or do I narrow it down to the people who are succeeding and there's evidence-based that the intervention that they had? For example, effectiveness of trauma-informed interventions. That's a bold title. Oh, it's a dissertation again. Drat. Avoid the dissertations because they don't necessarily get linked, but you can use the keywords. And here you can see the date range too. So you can see that this really took off in 2019. Again, evidence that coronavirus made an impact in using this as an intervention. So before 2019 and after 2019, is there a lot more people using trauma-informed as a label for something? You get to decide. And if we wanted to, well, okay, so you're gonna have to sort out, so you could do trauma-informed care, but I have a sneaking suspicion that not everyone is using that term because there's trauma-informed delinquency interventions. That is care. But if you wanted to go very formal, you might be missing out on interventions where they didn't name it with care or play right after trauma-informed. Let me show you another set of databases. Once you've gone through these, I do recommend CINAHL too. Medline's okay, but CINAHL is the people that are working with populations. Medline is kind of like, this is a prejudice. You might have to double check to validate this. But I think Medline is like somebody comes in and they have bruises and you can say, oh, this person needs trauma-informed care, and that's the end of it. Whereas with CINAHL, they have much longer extended access to patients or patients coming in, they do triage and things like that. Okay, high-level systematic search tools. Your faculty sponsor or sponsors may have a favorite. These both do the same thing, Web of Science and Scopus. I don't know which one's going to be more popular with your faculty. There's no convention that I've found in FCS. And do you know Marissa Diener? Hopefully you get to work with her. I adore Dr. Diener. So you can say, I worked with Dale and he said that I should talk to you. And she'll be like, oh, okay, let's talk. In this one, this is looking at all the disciplines. So metallurgy, political science, dance, including the social sciences, STEM, mathematics, astronomy. You get the idea. But these are all the journals that have esteem. So if you wanted to quantify esteem, so the Journal of the American Medical Association has high esteem because it's competitive. People want to be published in that one because you'll get the greatest readership. But how many medical journals are there? There's a whole bunch. So these are the ones with the highest esteem, quantified by the number of times that things get cited. So I'm going to add a search field. I'm going to do that same search. Trauma informed. And then I'll go back to play. Oh, you know what? Let's try play therapy. So that's the name of a specific intervention. And I'll just leave it with not searching in the abstract because I want to show you how the citation management works. This one is indispensable for a literature review. If you made it this far in the video, kudos to you. I do go on a bit. Okay, so it's looking through 70 to 100 million scholarly articles, all peer-reviewed. I'm going to move my head again. And this one's really slow to load. Oh, there's only 8. Ooh. I might want to change. Let me change my search. Play therapy, or play, or dance, or art. They want me to take a survey too. I should be kinder and take their surveys, but we have what we have. So when you put in an or statement, you're adding on to that list. So we went from 8 to 257. Is that good or bad? You get to determine this. And the more that you search through this, the more you'll become confident in that you've seen stuff before and you can omit keywords. So here you can see that date range again. This has 0 citations, but it was just published this year. So is that good or bad? You get to determine. Oh, that's really cool. Oh, what's medical trauma versus trauma-informed? Trauma-informed does show up in this somewhere, but if you want just stuff in the title, you know how to do that. So if you do cited by highest, what that means is in this database, which goes back roughly to the mid-1990s, on the keywords that we put in, the most important articles will have the most citations. So this one, systemic self-regulation, ooh, I like that. A framework for trauma-informed services in a specific population. This was so important when it was published 10 years ago that these 101 articles could not exist unless they cited this one. That's impact. That's what gets you tenure, grants, streets named after you, Nobel Prizes, et cetera, et cetera. So as you go through, if you're going through this list in order of the number of times that something has been cited, you can go through and you can go, oh, resilience. Remember, that was a hot word, and you don't hear about it as much. Now it's more of like burnout, and I think we're done with resilience. That's definitely pre-pandemic. Now we're just like, oh, wellness, well-being, human trafficking. So this is all over the place. It gives you the luxury of narrowing down. Oh, here we go. Adult mental. Oh, I don't want. So systematic review is looking at a bunch of articles. If it doesn't have review in the name, that means that they're doing original evidence gathering. So say this is a good one. Well, let's go back to that first one. Framework for trauma-informed services. If this is a good one, all you have to do is click on this. Well, download that article and read it, obviously. Now, this is all very meta. We haven't looked at a single article yet. What you would then do is go click on those 101 and then sort those by number of times cited. And then you can see, well, I only want to see the ones that are post-pandemic. Oh, looks like they're all here's ones that's post-pandemic. So if you have a set of rules, like it has to be post-pandemic or pre-pandemic, that might help you narrow down too. Oh, that's cool. So this is studied at the micro and the macro. It looks like a lot of these I've seen are like looking at huge swaths of a population, like a juvenile justice facility. So that might be another way to narrow down too. Okay. As you go, yeah, you can look at, oh yeah, by the way, if you're doing a dissertation, you can go into dissertations, and there's mostly North America. You can see if anyone's published anything on what you're looking at, and you can see if there's that null search result. I think there's lots of potential. What you do from here, if you get yourself on a roll, is save your citations, get yourself a citation manager. The Zotero is my favorite, but some faculty like EndNote, or they like Mendeley, or they like different citation managers. But go through, the first time you do a review, download the ones that that look interesting. You can't narrow it down until you start going through titles and going, yeah, that's me. No, that's not what I'm looking for. Yeah, that's me. And once you have a list of citations, then you can start to go, oh, I see a theme of what I'm interested in. And this is a back and forth that you and I can have, or you can work with your instructor, and you can start to develop the framework of what it is that you want to study. So it looks like this is a big field. Going between play and care, you're going to have to tightly define those, like what is care, what is play therapy. Care is kind of open-ended and ambiguous, whereas play therapy can be very nailed down and specific. So there's one thing that you get to do. But as you go through, take breaks, because your prefrontal cortex needs time to churn through everything that your amygdala is sucking up from this. And for me, with emotional dysregulation of ADHD, every time I read something, I go, oh, this is too much, this is overwhelming, and that's part of the process. But as you go, you're going to be finding that you're going to start a narrative of like what your reader needs to know if you don't have to do a systematic review. And you can start to go, well, they need to know what trauma-informed is. They need to know what the ideas for care. They need to know examples of play therapy. And each one of these should be a scholarly article that you find. And then even just reading a bibliography, your reader should be able to take those stepping stones of those scholarly articles and get to the point that you want to make. And then you come out looking brilliant. They hand you your PhD and Bob's your uncle. Let me know how it goes. And I encourage you to take lots of breaks. This is kind of like what do they call it? You might need cognitive behavioral therapy to get through this, but that's what I'm here for.